All right, thanks everyone for joining. My name is Joe Bertucci. I'm a physical therapist here at PTW in Ardmore. This is Mike Quintons, clinic director in Ardmore, and this is our guest, Dr. Alan Harris of Beatty Harris Sports Medicine. So we wanted to, first of all, thank you guys for tuning in. We're going to do kind of a deep dive into returning to running. And we figured as COVID is hopefully winding down, at least things are opening up and the weather's getting nicer, people are going to get out and get moving, get back to their activities, running being a main one. So wanted to get some information on what people can look out for when they're returning to run, what they should be thinking of, looking out for injury wise and how they can prevent those things from happening. So again, I just want to introduce my panelists here. This is Mike Quintons. You want to tell us a little bit about yourself, Mike?
Yeah, thanks, Joe. I'm a physical therapist, OCS, and I'm the clinic director, was in Newtown Square. Now I'm in Ardmore. Joe's with the staff now over in Ardmore. And so we treat a lot of orthopedic. My passion is sports medicine and like manual therapy, sports performance, TPI trained, FMS trained. So a little bit of my background.
All right, Dr. Harris, can you tell us a little bit about yourself?
Sure. So Dr. Harris at Beatty Harris Sports Medicine started a private practice in sports medicine with a colleague, Dr. Trisha Beatty, back in July. And our focus is on basically non-operative orthopedics. We do a lot of ultrasound guided procedures in the office, whether that be injections, needling, tenotomy, also cover a couple local sports teams, concussion management, those types of things, and all kinds of sports medicine injuries.
Where are your offices located, Dr. Harris?
So 3 offices, one in Newtown Square, one in Cherry Hill, and the other one is in the Navy Yard in South Philly.
You can find PTWs all over Montgomery and Delaware County. So I'm primarily was at Newtown Square with Mike. Now we're over in Ardmore, right off Lancaster Ave on Ardmore Ave, next to the post office. So without further ado, we'll get started here and kind of dive into what some runners should look out for. So Dr. Harris, I want to ask you first, when you see people return to run after a long layoff, or in this case due to COVID for the most part, what sorts of things or what sorts of injuries do you typically see that pop up?
Yeah, I'd say the most common thing that we're seeing now is a lot of soft tissue injuries. It seems like more so than before, a lot of people are coming in with whether it be hamstring, some hip flexor, IT band, the common runner things that you usually see. But it seems like we're seeing them at a much higher rate. Usually what, the typical story I get is someone who has been off for a long layoff, finally gyms are opening back up or sports have returned, and now they're getting back, whether it be for track practice, got out there running, and then within the first couple of practices, they have this injury. And kind of the most common theme behind it that I see is that I was, a fairly elite level runner and things had shut down back in March. So I picked up kind of right where I left off at my elite level running, whether that meant, they're running every day or they're running the same mileage they had been running, or a lot of times the same kind of the volume and pace. And, so the most common thing I've been seeing is that people are just trying to pick up where they left off, and all of a sudden they get into trouble and think, I was here before, why am I having trouble now?
Right, and try to push ourselves back to that same level if they're not feeling great.
Exactly.
Mike, any comments on that?
Yeah, I see this. I'm seeing the same thing in the clinic. What's interesting about it is it doesn't seem to, it seems to be overused, but it seems to be like too quick of a ramp up, like you said. So it's not like they're at the very tail end of a marathon training program, because there haven't been any marathon scheduled. So is there anything you feel like we could be doing to prevent this from happening, or that some of these runners could be supplementing with their running?
Yeah, I think the biggest thing for any athlete, no matter what the sport is or the activity is cross training is so important. And there are more than one way. There's more than one way to get your cardiovascular fitness up, for running. So whether that be swimming, cycling, things that don't necessarily beat up on the body quite as much, you actually find with that cross training that you can actually build probably to a higher cardiovascular capacity than you had with just running, or than someone who purely just runs. But it's also about giving your body, a little bit of a break and trying to challenge it in different ways. And when you do that, not only are you helping to prevent those injuries, but you're also, adding to kind of your repertoire and things that you're able to do, muscles that you're using to help prevent additional injuries.
Yeah, I see that a lot as well. I mean, we want to get people, a lot of patients that I treat with these types of injuries. They like to run, they call themselves runners, and that's what they like to do, and that's totally fine. But eventually you got to break out of that straight line. You got to work in different planes of motion, work different muscles, and I totally agree with that.
What are some good ways that we could be doing some cross training? I mean, I know like rowing, biking. Is there any other like things that you would recommend that are accessible maybe to some people?
Yeah, I mean, now that things are starting to open back up, I think swimming is a big one, just because it's a totally different type of cardiovascular fitness that you experience with that. You're using much different, musculature than you would be as a runner. And swimming is just great for anyone who has any kind of pain in general and is still wanting to get out and exercise, because it really does not put a lot of, pounding or, quote unquote mileage wear and tear on the body typically. So, obviously you're using more upper body. So just like with rowing, where you're doing a lot of upper body, but still working cardiovascularly, same thing with swimming. Yes, you're kicking a little bit, but the majority of it is upper body. And then rowing, I think, is another great way. Again, not a lot of pounding, and also kind of changes things up. I mean, things can get stale, with just doing one activity all the time. So changing it up, even if you find yourself, experiencing burnout in some sense of the word, changing up your activity can be helpful in that way too.
I'll add that those are all great examples. The elliptical is something else too. But I mean, even within running itself, I have found that runners typically get the best performance when they change their running program up and of itself. So different mileage, I think you mentioned that, but maybe doing tempo runs where you're doing some, higher tempo running for short periods of time, and then some really slow running in there too. So there's different ways of getting the mileage without causing irritability to the soft tissue.
Getting back into that, so is there anything else besides fitness that you might want to pay attention to when you're returning? I'll open up to either of you guys.
Yeah, I mean, adequate recovery time is important. I mean, sleep, we can talk about that, forever, and how important sleep is to recovery. And, certainly younger athletes who tend to stay up later and have to get up early, whether it be for school or, over the summer, some having part-time jobs, whatever the case may be, are trying to stretch out their day to get them, the maximum amount out of it that they can. And they tend to kind of cut out the sleep portion and try and, short that. But sleep is very important for recovery. I mean, honestly, too, I know a lot of runners who say, well, I run 7 days a week. And that's probably not the best thing. I mean, that's, those are the athletes that I tend to see in my office for, stress fractures and things of that nature. So really encouraging athletes that, you can work out 7 days a week without running 7 days a week, or, just doing the exact same type of running 7 days a week. So even if you're, taking a day or two a week where you're doing some type of cross training, working on upper body stuff, changing it up a little bit can be super helpful, where you feel like you're still getting, adequate workouts in without doing the same thing 7 days in a row and leading to some of these overuse injuries that we're seeing. Nutrition, is obviously very important. Recovery after a run, protein shakes for muscle recovery, those kinds of things. There's some collagen supplements out there that have become fairly popular. I know some of the professional sports teams are using them, and the timing of those, we know is fairly important. We used to say it had to be right away, but now it seems like there's sort of an hour to 2 hour window where really, if you're getting those things in after a workout, they can be, just as effective.
Yeah, I heard a saying when I was in school, which I thought was great, that a lot of overuse injuries are really underprepared or under recovery injuries. And you're just, like you said, not giving yourself adequate time. And I think that point is awesome about the 7 days a week. Yeah, and if you want to work out 7 days a week, more power to you, but it's important to break it up. And I think a lot of people, at least that I've spoken to, they like their 3 or 4 mile run, they're comfortable in it, and they're maybe making improvements to their time, and they're worried about, if I don't run 7 days a week, then I'm going to lose that fitness. I'm going to lose it on my time, and not be as efficient in my runs. When I think it's quite the opposite. If you break it up, if you do a day or two, mix it in of cross training, whether it's in the pool, whether it's light strength training, that's going to make a huge difference for you.
Definitely. And one of the other things is, not everyone can come back from a long break as fast as everyone else. So you might find that you're not back to a level that you expect yourself at, and someone maybe that you run with, or a teammate who's running faster than you now, but wasn't prior to when things had kind of been cut off. Not everyone recovers, or not everyone can get back to that same level at the same pace. So trying to challenge a friend of yours, or say like, okay, well, I was better than this person or faster than this person, so I'm gonna ramp up because I should be ahead of them, doesn't always work for everyone. Everyone's body is a little bit different. Everyone recovers a little bit different. So it's also important to remember that even though you may not be back to where you want to be, and someone's a little bit ahead of where you kind of would expect them to be, that's not always going to kind of bear itself out. You got to really kind of listen to your body, and be smart about how fast you really ramp up your training.
You mentioned sleep. There's a study out there, and we can make sure we tag this, that adolescents who get less than 8 hours of sleep a night are 1.7 times likely to experience an injury that prevents them from participating in sports. So that's almost 2 times, twice as likely to experience an injury if they're not getting 8 hours. I mean, that's a good amount. I think we know a lot of athletes that get 6 hours, 5 hours, so much less 8. So I think that's a big part of it. This is a huge one, strength training. I mean, like runners and strength training, I feel like there's this huge imbalance, and I've seen it with my own wife who's run marathons, where they just think that they're getting stronger by running, and that's couldn't be further from the truth. You got to hit the gym. You got to get stronger, and you can't just do legs and then back and bis and tries and chest. You have to do a balanced strengthening program. You mentioned nutrition. I couldn't agree more with that. Amen. But balancing it all out and the ramp up. So if you're doing a 5K, which I don't know about you, I know IV Rehab, here's a little plug, is doing a virtual 5K, like everyone, and which is cool. I think it's great. And it comes with a 5K running program. I love that. Stick to the program. Don't ramp up too fast. And if there's pain, stop. Back off a little bit, right? Use your resources.
Yeah, that's the biggest thing. I mean, people experience pain. I mean, runners especially are a different breed when it comes to pain and injuries. They'll run through almost anything. And, really listening to your body when there is pain, because oftentimes, if you get that addressed earlier, going to see your sports medicine doctor, your physical therapist before it really kind of becomes an issue, a lot of times these things can be corrected and worked on while you're able to continue training. But when you push through them sometimes, you get to a point where now you can no longer even train with it. The pain's so bad. So when I see people that are already at that point, and I have to tell them, well, we have to take 2 weeks or whatever it is off from running, that seems like the end of the world to some runners. But, really, if you listened to your body a little bit earlier and, kind of addressed it sooner, oftentimes we don't have to do that. So the earlier I see somebody with a problem, the easier it is to address, the faster the recovery is. And oftentimes we don't have to pull them from the activity at all.
And that was something I wanted to bring up is, if you're a runner and you're getting back to running, what sorts of things should you look out for? Because I feel the same way, right? If you have starting to feel some tightness in one calf versus another, or the bottom of your foot starts to bother you, like at what point would you say, hey, I got to get in and see, my healthcare professional?
Yeah, I mean, I think the biggest one to really watch out for is that like slow onset of like, okay, I have pain, something I haven't really experienced before. And so I'm going to keep running through it. And now today it's a little bit worse. And it's okay, maybe I'll take a day off and see if it gets a little better, and then I'll run again. And like, oh, today it's still about the same as it was. Maybe the next day is a little bit worse. I mean, those are the ones that really, tend to lead to bigger problems. And, right off the top of my head, I think, stress fractures. So certainly if you're seeing any bruising, swelling anywhere, those are things that you want to get looked at immediately, just because, again, the earlier you catch it, there's a difference between a stress fracture and a stress reaction. So stress reaction, we see, the start of it in the bone, the swelling that's building up without a true fracture line. Those are going to heal up much faster than someone who runs through something like that and now ends up with an actual true stress fracture. So, that's like the biggest one that I would say to watch out for when you're coming back. And then obviously the one where I was running and I felt a pop, or I heard, or I remember the exact instant or step when it happened. Those are the ones that you want to get looked at right away. Every muscle pull or tear is a little bit different. So, straining a muscle strain is a tear, whether that tear is very minor, mild, or whether it's major. They're different degrees, but a strain is a tear. So there's an injury there and there's a problem that needs to be addressed. So even if it's minor or feels minor to you, based on the location, that can become major pretty quick. So those are the kind of things that you want to get checked right away.
I love the 2-point rule. We use it for concussions all the time. If your symptoms increase by 2 points on a scale from 0 to 10 while you're running, shut it down. It's probably too much. And then the other thing is a pain that is persistent with running that you experience when you're not running. I think that's usually a reason to make a call, especially if that's getting worse over time. So I would recommend a running journal personally. Write it down. What did you feel during your run? What was the intensity of it? That way you can reflect on it and actually see if that those numbers are different today than they were last week.
Mm-hmm. Yeah, totally agree. I think, if you have a question, I mean, I know at least for us, I know Dr. Harris, your office is very big on being able to communicate directly with you guys. I mean, give us a call. If it's something that, hey, I started running, started feeling this, what do you think? At the very least, we can kind of talk through it. And I loved your point about the runners that'll say, I start to feel, so I'll take a day or two off, which I wanted to kind of tie into our other conversation about, cross training. I mean, recovery and rest doesn't necessarily have to be sitting on your couch doing nothing, right? You can do active recovery, you can do active rest to be doing other things while letting, whatever is aggravating you rest as well, and kind of just to make yourself stronger around it. So if someone has pain currently, I mean, how would you think best address that? Is it call the doc immediately, give it rest, or where would you go from there?
Yeah, I mean, if you've been, an athlete or runner for some time, when, a pain or something that you're experiencing is different than what you've experienced in the past. Or maybe you've had a bad injury in the past and it's starting to feel similar to what you've had in the past. So you kind of know, like most often you'll know, am I just hurt? This needs a little bit of time, or am I truly injured and I really need to get this looked at? And so, knowing the difference there obviously is very important. But, when you have something like that, the easiest thing to do is reach out, sooner rather than later, like I said, rather than letting it linger and become worse. I mean, better to get it checked out and find out like, okay, great, this is minor. I can keep training through it. I can do, physical therapy while I'm training, and I'm going to blow through this and not have any issues. I'd rather know that as a runner, I'd rather know that early on than to say, okay, I'm going to wait and then, find out later on, like, okay, great, now I got to take, all this time off because of this. So now not only did I try and come back, but now I'm doing the same thing where now I'm going to have a bit of a layoff, and, and now I'm going to struggle to come back from that again. So, and even if there is an injury like that, I think the other important thing to remember is, there's always something that you can do. So like, even if you are experiencing an injury that prevents you from doing some sort of running or your normal activity, just because you have, an injury to your lower, to the lower body doesn't mean you can't still do exercise and things for the upper body, right? There's always things that you can do to stay active, even when there's something going on.
How does a visit like that go for you, right? Like, so let's say I'm that person and I call and I schedule an appointment with you, I show up at your office, and we're in the back room, in the eval room.
Yeah.
So how does that go?
Yeah. So, most often people call, say I have, this part of the body hurts, and depending on, where it is, sometimes we'll have you get an x-ray prior to coming in so we can look at that before we even see it, if there's any concern from a bony injury type standpoint. And then, my evaluation process is always, I go through the whole history of what happened. So something like keeping a journal as a runner would be really helpful for me, because then you have a timeline of when it started, and how it ramped up for you and kind of where things are at. But I go through the whole history of what's been going on, figure out what your main symptoms are, what brings those symptoms on, how bad are they affecting just your running? Are they affecting daily life? Is it affecting your sleep? And then I go through a thorough physical exam, and oftentimes, especially in runners, when it's a lower body thing, whether it's knee, hip, back, whatever, oftentimes I'm evaluating all three. So knee pain can sometimes come from the hip, can sometimes come from the back. So it's a thorough evaluation of where your pain is truly coming from, what is the actual cause of that pain. And then oftentimes I use ultrasound in my office a ton. So I use a diagnostic ultrasound to look at muscle tissue, whether you're concerned about a tear in the Achilles, the calf, the hamstring. I can look at all of that with the ultrasound and use that as another diagnostic tool in addition to an X-ray, where now I can look at the soft tissues dynamically and look at them, as I have you move them. So I do that. Almost everyone who comes to see me ends up getting an ultrasound in the office right there to take a look at things. And then we come up with a plan, as Joe and Mike had alluded to, one of the big things for our practice is, direct communication with other providers. So with our physical therapists, because they're the ones who are ultimately going to get you back to where you want to be. So, it's direct communication with them saying, here's what's going on. Here's what I've seen, from my evaluation. Would love to get your input on what you see from their evaluation. Here are the things that I'm seeing that I think they need to work on. Let me know if you agree with that. And that way, when they go and see the therapist, they can come back to me and say, hey, totally agree with you. Here's what I saw, or, I agree with you, but I also found this. Did you notice this on your exam? So that, like, having more people, kind of as a part of your diagnostic team and your treating team can only help.
The perfect segue, because I was going to flip it back to you, Mike. So if someone comes in, whether they see Dr. Harris or someone else, and get a referral for physical therapy, saying, I've got pain when I run, what is a typical evaluation? What would they expect to experience coming into it? I mean, I think I know pretty well, but just for the audience.
Sure. No, that's a good question, because there's going to be some similarities, right? And that's why we would communicate. So, pretty much a thorough history is always important. The pattern of the pain, is it morning, is it evening? Is it happen only with running? Is it not with running? What interventions were already done, right? Maybe there was an injection and Dr. Harris is okay with the person, the patient continuing to run. So the history is very important on how we progress going forward. So in addition to the history, I'm doing a movement assessment, right? Like Dr. Harris said, he would do a thorough exam. If it's the knee, he's looking at the hip, he's looking at the low back, ankle. So we have a running screen that we do at the Newtown Square office and throughout PTW, but also in the Ardmore office. That consists of everything from single leg hops to a lunge matrix to range of motion assessment to RDL. So we're trying to identify where the deficit is. Overhead squats, big one, ankle dorsiflexion, kneeling. So the bridge with leg extension. So these are just, giving away all these pearls here, but these are all these movements that help us to identify where the deficit is. Is it strength? Is it mobility? Is it coordination? And then we actually do a running assessment. If the patient is willing and able to and cleared by the physician that they're referred from to run, we're running. We're videotaping from the back, we're videotaping from the side, and we're going to analyze the running technique. We're counting the number of steps in 60 seconds. We're looking at where the foot strike is. We're drawing lines. We're nerding out. And usually I'll get with Joe or another therapist or even Dr. Harris if he's here. If we're all in the same office, and we'll look at it, or we'll send videos or pictures to the doc. So to me, that's how we put together, a thorough assessment with a game plan. And then that's the final stage is treatment, right? So, I mean, it's a jam-packed, it's an action-packed session because we're doing manual therapy to address the deficits that we find. We're doing treatment as well in terms of exercises. And then if we have the time, you're running again. Let's see how it looks. Was there any pain this time around? So it's that assess, treat, reassess approach, and then exercises to go home with. So it's a little bit of everything, but I think if you have time to get all of those parts in, and that's when you're going to find, you'll find the best results going into the second session.
Mm-hmm. All right, so got a pretty good idea of the assessment evaluation, and not have to go through an entire plan of care, course of care, but kind of just give me the bullet points. What would you look for? What would a runner be able to expect if May started, weather turned nice, I started running, have some pain, it's mid-May, I come to see you. When can I get back to running? That's what people really want to know, right? When can I get back to doing what I want to do? I know it's not an easy question to answer, but I'll leave it open to both of you guys.
Yeah, I would say that starts with you and what you see.
I mean, it really depends on what's going on. I would say, there are certainly things that are gonna, necessitate taking a break from running. But most injuries do not, or most, the most common ones and the things I see most often don't. Obviously, something like a stress fracture does, or an actual muscle tear from the tendon, from the bone, like that does. But a lot of times, some of these more smaller, lower grade, tears are happening because of deficits in other places, with strength or flexibility. And so that's when the physical therapist is able to find and address those issues. You're still able to kind of, to be able to run through that. It's very rare that I pull someone from an activity and say, like, look, you got to shut it down. And if I do, there's a very good reason for it. And again, the sooner someone comes to me with the complaint of something, oftentimes, that will allow me to keep them in the activity without having to, truly shut them down, fully, and still be able to get them to recover. So the earlier they're able to recognize, there's an issue here that's not something I'm used to, and get in and be seen, the sooner, usually we can get them back to run.
The key is load management. I mean, once we get the clearance for running, I typically interpret that as how much can they do, and that's my responsibility. So that's load management. And load management is at what speed, on what surface, are there hills, are there not hills, so at what slope, and then at what duration, right? For how long is also important, and that will give you the total distance, but that's super important. So that's how we would progress that. And then in terms of in treatment, everything from isometrics, if we're looking for neuromuscular re-education, or everything from that to Therax. We're looking at flexibility, manual therapy. Are we looking at mobility of the midfoot, for something if they're, if they've been wearing orthotics forever, and they're wearing Hokas and anti-support and pro support sneakers. So it all depends on what the game plan is. But once they have clearance to run, it's load management and then sport specific strengthening as we get going. So maybe we're doing plyometrics in the clinic before we're actually running if we're not running yet. So contact is super important as well. So, I mean, we could do a whole show on just that alone, but a slow progression is usually the smartest way to do it. And it can't just go up, and we can't just progress every session, right? We need time off to recover, just like I said before.
Yeah, gotta listen to your body, listen to what your symptoms are telling you, go from there.
Is there anything else that we're missing, Joe, that you would throw in there?
No, I think you guys really hit the nail on the head. Again, I'm using these little kind of phrases or nuggets that I've heard. Someone once said to me that, people run to get in shape, but you also got to get in shape to run. And that's kind of maybe the crux of what we're talking about is if you, want to get back for, whatever 5K or half marathon, anything coming up. I mean, you got to take that progression. And just like you mentioned a second ago, I mean, listen to your body, right? If you're starting to feel something, either ask someone, ask a professional, or give it a second, see how you respond. Is it something you felt before? Is it something that you've never felt before and this feels way worse than usual? That'll kind of give you an indication, but you got to take it slow. You got to progress with what your body is telling you is able to be done. And then again, if you get into a scenario where you do have the injury, you've already kind of pushed a little too far. That's where we come in. You kind of work with us, on both ends, a physician and physical therapist, to put that plan together to get you back to running.
Yeah, also utilizing resources is super important as well. So PT is obviously important. At least Joe and I think so. I know Dr. Harris thinks so as well. But a local place that has specialists with running mechanics, or even like shoes, like shoe appropriateness or sneaker appropriateness. So I know there's there's places in this area. I think Bremar Running Company, the Running Place. I'm sure there's more that aren't coming to me right now that have the specialists that know what shoes are best for what injuries. I think is also important. So I'll look at the bottom of the sneaker, but I'm not making a recommendation on what sneaker they need because it changes all the time. It's like models of cars, they change every year. So I think that's also important to use. And then communicating with other running coaches is also important, whether you are or the athletic trainer. That's your world too. So we all have to communicate with one another, whether it's text, email, phone call, to help that individual get back to what they want to do.
Yeah, and I mean, for any like high school, middle school athletes in the area, you check their ATC, your athletic trainer. I mean, they're kind of the first line. They're right there with you on the field or in the training room. Ask them questions. Kind of like Dr. Harris was alluding to. It's not worth pushing through a little pain that turns into big pain and that ruining your season, right? you've got a season coming up, whether it's club or school season, you know, if you have a little bit of discomfort, again, check it out, ask a question. Trainer might look at it and say, it's nothing you don't have to worry about. It's a little tweak, you can keep pushing. Or they might say, listen, you know, you've got a week before your game. Maybe I'll talk to coach and we'll run at 50% instead of going full tilt for this next week and see how you feel leading up to the game. So having that conversation, I think, is really important too.
Amen. Absolutely. Yeah.
All right, so I think that'll wrap it up for us. I forgot to mention in the beginning, we were supposed to have Dr. Romanski here as well, podiatrist from HealthPlex. He unfortunately had a surgery come up, so he wasn't able to make it. But we're happy for everyone who was able to join in. Thank you, Dr. Harris, for coming to our clinic in Ardmore. Mike, thanks for having us.
Yeah, thanks for coming, guys.
And again, just to kind of wrap up, Dr. Harris, where can they find you? Where can people reach you if they want to reach out?
Yeah, so it's Beatty Harris Sports Medicine, www.beattyharrissportsmed.com, or you know, phone number is 610-601-9177, and that's a central number for all of our offices. But you know, if you just Google Dr. Harris or Dr. Beatty, you know, we'll come up. But yeah, so again, Newtown Square, Cherry Hill, Navy Yard, kind of all over.
Yeah, PTW Ardmore, PTW Newtown Square. Google us with phone numbers are up there. I haven't both memorized off the top of my head. I should. But nonetheless, we're on Instagram at PTW Ardmore, PTW Instagram, or PTW Newtown Square. Facebook page is the same. And then ivrehab.com/PTW Institute is also somewhere else you can find us. So yeah, Joe, thanks for having us.
Yeah, absolutely, guys. Thanks. Appreciate it.